What I want to do this for was I want to get off the drops. The drops are sort of a pain. Twice a day, every day. Always remember your drops, make sure you have them. And so if I can get off of it, I'd be really happy. Dr. Friedman had treated me for glaucoma, and recently he mentioned that there is a study going on that would help my glaucoma, perhaps where I wouldn't have to use drops any longer, and if I'd be interested in it. And so I told Dr. Friedman yes I would, and so he sent me over to the study group. The study group asked me a lot of questions, made sure I was qualified for it, the kind of patient they needed, what they wanted. And so then I met Dr. McCabe, and she felt I was an adequate patient, or was what they were looking for, and so they performed the study, whatever the study surgery was. At the same time I had my cataract corrected. It was not very exciting. I mean, it was just another day. I had had my other surgery done here again for like 3 or 4 years ago, so I knew sort of what to expect. Very satisfied with the treatment, the surgery all the way through. Everybody was at the top of their game. They knew what they were doing, and I'm impressed with Dr. McCabe. She really knew what she was doing. In fact, later on I saw an article where she actually did a study and had like 1,000 of her peers looking at her doing surgery, actually doing corrective surgery. That's impressive. For 2 reasons. You know, I want it for myself, and then if it's something that they can bring to the public, it's sort of a give back. And I have to say that all the way through. I associates from Dr. Friedman's office to this office, Dr. McCabe's office, and the study group, they're very aware of like my time, so they try to get you in and out and make things happen. And as a patient, I really appreciate that. The advice would be to get it fixed. It was funny when I had mine, the one eye fixed, that I could close one eye and see real well, and close the other eye and not see very well. And that's why I was very anxious to get this done with the second one, because I knew it was going to be great. And it really is. You know, everything is nice and bright, and the clouds are white instead of yellow, and I don't have these rings in my eye at night when trying to drive a car. So yeah, I'd recommend it. The fact that I can see so much better is comforting, and it makes me feel better.